Well, hey guys, in today's video, we're going to be talking all about short contact therapy. And no, I'm not talking about aliens coming down from outer space in their UFOs to put a chip in your head, but rather short contact therapy with active ingredients and skincare products. It's just what it sounds like. Short contact therapy involves putting an active ingredient on your skin for a reduced amount of time. And it has a variety of advantages. There's a good chance you've already done some form of short contact therapy, especially if you've ever done one of those popular face masks. After you finish the mask, you rinse it off. A lot of at-home peels are essentially short contact therapy with maybe a hydroxy acid or some other fruit acid intended to exfoliate the skin. You only do them, 10 minutes, maybe 20 minutes, at most 30 minutes? Short contact therapy. Short contact therapy is particularly advantageous when introducing skincare ingredients that are known to be irritating. Benzoyl peroxide, retinoids, glycolic acid, lactic acid, salicylic acid, any kind of exfoliant. The idea behind short contact therapy is that by reducing the amount of time that you are exposed to the ingredient, you can still derive benefit from it while minimizing those irritating side effects. And irritation can manifest in the form of redness, peeling, dryness, and heightened sensitivity to things that come in contact with your skin. It's a major reason why people abandon their skincare products. It's a major reason why people stop using their prescription retinoid. They simply can't tolerate that dryness and peeling. A lot of acne active ingredients, topical medications, they are pretty drying and irritating. Your skin can get accustomed to that ongoing use, but in the beginning especially, it can really be, like I said, a major stumbling block. And a downside of the increased irritation is that you have more water loss from the skin, which leads to dryness. And that increased water loss, increased dryness makes the skin more vulnerable to irritation. It actually can end up worsening the acne. Not only are they getting frustrated because their skin looks worse than it did before they started the active ingredient, but they're getting more breakouts. It's not necessarily that the active ingredient caused them, but rather the side effect of irritation is just making everything very inflamed, causing skin problems. For people who have a deeper skin tone, this type of irritation from active ingredients can actually put them at risk for post-inflammatory hyperpigmentation. An advantage of short contact therapy is that it's a lot more conservative and it minimizes that risk of the kind of irritation that would put those folks at risk for dark spots that are very stubborn to fade. Short contact therapy is particularly advantageous for people who already have very sensitive skin. If many of you have rosacea and your skin is very sensitive to things that come in contact with it, so much so that the idea of using a retinoid is very intimidating for people who have rosacea, and many don't tolerate it. However, it's not a rule that people with rosacea cannot use a retinoid or over-the-counter retinol. It's merely how do we get them through that retinization process without flaring their rosacea. Short contact therapy is a great approach for those individuals. Retinol and prescription retinoid, once you are able to tolerate them, they can genuinely benefit the rosacea. They can reduce the number of inflammatory papules and pustules and really long-term help control the symptoms of sensitivity by improving barrier function. For folks who are really sensitive and or have rosacea, short contact therapy is a great way to baby step introduce retinoid or retinol. From a practical standpoint, I find that a lot of topicals, especially if they are in a gel, they can end up conflicting with other products that you might want to layer on top, especially sunscreen. Have you ever used a treatment gel and tried to put sunscreen on over and you get that pilling where the sunscreen rolls up? So when products are not compatible, you can get that pilling. And if we're talking about your sunscreen pilling up, then it's not going to be effective at protecting you from the sun. So how long do you need to leave the product on your skin in order to derive benefit while simultaneously minimizing the irritation? That's going to vary a lot depending on what it is, depending on the ingredient, the overall formulation, the concentration, and what area of the body that you're putting it on. In the case of tazarotene gel, 0.1%, for example, anywhere from 2 minutes to 5 minutes can be effective for tolerating it, but still getting benefit by reducing the number of spots. If you're thinking of introducing benzoyl peroxide into your routine, a really great way to do short contact therapy is to take advantage of a benzoyl peroxide wash. You lather it to the skin, leave it on for a few minutes, and then rinse it off. And the advantage here, which is unique to benzoyl peroxide, is that in contrast to leaving it on the skin, when you are able to just rinse it off, you don't have to worry about it coming in contact with fabrics. If you've ever used benzoyl peroxide, you know that it can bleach towels and things. So by doing a short contact exposure with benzoyl peroxide and then just rinsing it off or washing it off, you don't have to worry about that as much. Now, the benzoyl peroxide washes, they can actually reduce the burden of the bacteria that contributes to acne with as little contact as like a minute. Some studies suggest within 30 seconds, but of course that's going to vary a lot depending on where you're using it. You know, the skin on the back is a lot thicker, so presumably you're going to need a longer exposure. That's why I always say a few minutes. Speaking of benzoyl peroxide short contact therapy, Neutrogena make a mask, a benzoyl peroxide mask. It was basically like a benzoyl peroxide wash that you could either just lather to the face, leave on for a few minutes and then rinse off, or do as like a full-blown mask and then rinse off. I used to use it a long time ago. So that is an effective way to start introducing short contact therapy with benzoyl peroxide. You can also do short contact therapy with the leave-on forms of benzoyl peroxide. 2.5 benzoyl peroxide left on the skin for 15 minutes, at least on the face, can help to decrease the burden of that bacteria that contributes to acne and can be effective. And then you can increase the duration of time as tolerated and potentially end up leaving it on the skin overnight as directed. So again, the advantage of short contact is it really gives you a lot more control in terms of feeling like, okay, I think I seem to be tolerating this in this short window of time. I'm going to try bumping it up a little bit more. And then if you get too much dryness and irritation, you can reduce the amount of time. Tretinoin 0.5% cream applied once a day for 30 minutes and then washed off, actually shown in a study to be as effective as typical once daily use after an average of 12 weeks. So the thing about short contact therapy is it might take a little bit longer for the ingredient to start working, but ultimately you'll get to the same results. Ultimately, it gives you more control, it reduces irritation, and if you have a deeper skin tone, by reducing the irritation, by shortening the exposure time, it helps lower that risk of post-inflammatory hyperpigmentation, and overall just makes it something easier for you to tolerate. Salicylic acid is another active acne ingredient that can be pretty drying, and you'll find it in face washes. So there again, you're using it short contact time, and it can be effective. You can also buy leave-on salicylic acid products like the Paula's Choice Liquid Exfoliant or the Peach Slices Acne Moisturizer. And you'll notice that on the market, there are a variety of different percentages of salicylic acid. Now, the lower percentages of active ingredients, they're going to be less irritating. And they can still be equally effective, they just take some time to work. So with the lower percentages, you may find that you're able to increase the contact time faster without getting irritation in comparison to the higher percentages. So that's just another little thing to keep in mind. Overall, when it comes to short contact therapy and getting used to the irritating side effects of things like benzoyl peroxide, retinoid, or salicylic acid, it's also going to depend a lot not only on the concentration but the formulation overall. When we're talking about tretinoin, there are actually a lot of types of prescription tretinoin, and they all largely differ in the vehicle, the inactive components that are helping to deliver the tretinoin. And they also differ, of course, in percentages, the percent of the active drug in the product. The vehicle, the other stuff in the product, it's gonna determine the penetration. So that will largely influence how irritated you get. For example, one innovation in tretinoin formulations was microsponge delivery systems. Basically a sponge, more or less, on a microscopic level, and within the cavities of the sponge you have the drug embedded. It allows for slow release with things like increase in temperature, changes in pH, and the action of rubbing the product onto the skin. You get release and slower deposition of the active drug onto the skin within the pore. Ultimately, that helps reduce irritation, in contrast to the old school forms where you just kind of get it all dumped on the skin at once. That can be really irritating. Then you also have micronization. This is something you'll find in over-the-counter benzoyl peroxide products and also prescription tretinoin. Micronization is kind of what it sounds like. It's making the particles of the active drug smaller. And the advantage here is that they end up going down into the pore and localizing there a lot more easily, as opposed to kind of dumping randomly all over the surface of the skin. And therefore, you get less irritation. Now we have newer generations of retinoids that are less irritating. We also have newer formulations like the Tretinoin lotion. I have a whole video on this, which have ingredients that are more hydrating and can help in reducing the dryness and irritation. I'm telling you all of this nuance about Tretinoin formulation, for example, to illustrate to you that regardless of what we're talking about, whether it be a retinoid or benzoyl peroxide, regardless of what it is, there's going to be a lot of variation in formulation that's going to influence how easy it is for any given individual to tolerate it. So in other words, how you introduce it and how you're able to increase the frequency of use, it's not going to be a one-size-fits-all approach. Some formulations will be easier for you to start increasing the frequency of use or increasing the duration of use if you're doing this short contact therapy approach. The downside of short contact therapy is that it's a bit involved. It's not just put it on and go about your life. You have to set a timer. It might be more inconvenient, and that actually might make you less likely to stick with it, but maybe not. Another downside of short contact therapy is that you're always going to want to put stuff on clean skin. So you've washed your face, you're going to put it on. But with short contact therapy, you're going to wash it off again. And so that's another round of cleansing. And y'all know from my videos that excessive washing can impair the skin barrier. So it may end up, you've got to be more conservative with how you cleanse. So long as you use a mild cleanser, a lot of the studies where they do look at short contact therapy for acne using different prescription acne treatments, a lot of them are using Cetaphil facial cleanser. Short contact therapy, many would recommend to a patient to do for the first 2 to 4 weeks when starting a prescription retinoid, so as to help the patient tolerate it better with less irritation, and then to self-titrate, meaning adjust the duration to longer and longer, all the way up to overnight. The last take-home point that I will make is that not everybody needs to do the short contact therapy, but I think it's a good thing to do either in the first 2 to 4 weeks of starting an ingredient that's super irritating, or if maybe you've tried the ingredient in the past, you tried introducing it by using it, say 1 to 2 nights a week in the beginning and increasing to nightly, and you can never get up to daily use, it's just too irritating, then try the short contact approach. That's another way to even more slowly introduce it into your routine. It really depends on you, the individual, how best to go about it. It makes the most sense to do short contact therapy with things like hydroxy acids, exfoliants, leave-on exfoliants, benzoyl peroxide, and prescription retinoids, over-the-counter retinols, which are known to be irritating in the beginning, but eventually people get over the irritation and are able to tolerate it. So it's all a matter in how slow you need to go. It's not a one-size-fits-all approach. Let me know in the comments, have you heard of short contact therapy? Maybe that is what you use to introduce a particular ingredient into your routine. Let us know in the comments. But if you guys enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.